I would say half our patients say, you know what, I know I have crooked teeth, I don't want to do anything about it, I just want the implants. And that, that's absolutely fine. We treat as it's needed. But again, we always want the patient to be completely educated and make that decision for themselves, so that they know they're making the right decision. So we had that conversation, and
Correct, yes.
and then we went ahead and decided to do both orthodontic and the implant treatment.
Yeah,
And
correct. I think originally when I came into the office, I had such bad genetics with my teeth that I felt like you should remove all of my teeth and we should just do permanent implants, was the original thought I had. And
Okay.
you suggested to me that I had some very healthy teeth left.
Right.
And so I had not considered that. So that took me some time to evaluate. But when you showed me what it would look like with keeping my healthy teeth and removing the teeth that were bad and doing the implants combined with the Invisalign braces, the picture that I would have would be a much more what I was looking for originally anyway, with just getting all permanent implants.
So I know when Janine, when she came to us, again, the advantage is that we're both working together and we see each other every day, so we can really work on your case on a daily basis or a weekly basis if we need to. If there's anything that arises, I can go to him right away and say, hey, listen, this is what's happening with orthodontics, this is what we need to do with implants, or he can even actually relate to me, this is exactly how much space I need for that implant or for that crown to go on top of the implant.
Right.
And I can tell Invisalign I need specific amount of space for what my brother has to do or what Dr. Nitash has to do. So, in that way, because we work in collaboration together, it works out a lot easier, a lot quicker, and there's always communication between us. So we discussed a little bit about the Invisalign. We took a scan with the new iTero element scanner, and we were able to see where the teeth were going to be moving to immediately within about 5 minutes. So I knew myself exactly where the implants were going to go, or where the crowns were going to go after the implants. I could show it to Dr. Nitash Patel as well, where he wants to put the crowns, how much space you need to gain, and then you yourself, you can actually see, okay, this is what my outcome's going to look like as well, which was a major advantage as well.
Absolutely.
Yeah. And so your treatment time was roughly about 10 months, is that correct? If
Correct.
we did original or the conventional Invisalign, which is changing the trays out every 2 weeks.
Correct.
Tell me a little bit about what we did and how we went about speeding up the process.
I opted for the Propel, and I did it in office. And so I can't remember how the procedure didn't last. It wasn't a long procedure. It was definitely less than an hour. I remember thinking this could be painful because you talked about how, what it would be doing would be like breaking up the bone around the teeth. And the procedure went quickly, and it was not even discomfort, I would say. And the great thing was I had conventional braces as an adolescent, where this wasn't like that. There was a little discomfort that first procedure, and after that, the teeth have been amazing. They just, and I see it happening in my mouth when I look in the mirror. I mean, it's amazing. The other thing is they're not noticeable. A lot of people don't even notice that I have them. People I work with day to day. The day before yesterday I was at work, and one of my clients said to me, have you always had those? Like, did you just get braces? And I was like, no, I've had them. It was like, for how long? He's like, ever since I've known you.
Right,
had never noticed.
Yeah.
So that's really cool.